Hello and good morning, everyone. Welcome to Eldercare's weekly webinar series. I am Adrienne Ostras.
I'm Melanie Lemke.
And we are super excited to have you here with us this morning. We love doing these trainings live. That way we get to interact with you every week. So just a little housekeeping things before we do our formal introductions. We do disable the chat on these. So if you do want to communicate with me or our special guest, just find the Q&A box. So it's a little box that says Q&A, and that is how you can communicate with us. So we would love to make sure the Q&A box is working. So go ahead and let us know. Are you currently selling hospital indemnity plans? Or have you never sold a hospital indemnity plan? We would love to know kind of the audience we're talking to this morning. We always record these as well. So if you're not subscribed to our YouTube channel, Eldercare Broker, I recommend subscribing. That way you get notified as soon as these recordings are uploaded. I see some more people jumping on. Good morning. Good morning, everyone. Good morning, Kiara. We got Levon, Michael,
Zach.
Oh, we see Zach in there. I think he needs some of this pink production in his portal. What about that, Zach? I'll kind of explain what that means once we introduce our special guest. I don't see any Q&As coming through, so can y'all hear us okay? Can you give us a good morning? Where are you listening from? Are you doing hospital indemnity? Are you not? I know there's a delay sometimes. All right, I don't see anything coming through. Hopefully you guys can hear and see us okay. But before I say we
I see some in here.
Oh, you do? Okay.
Yep, I see the Q&A. I think you're looking at the webinar chat. If you go up to
I see it.
To the bubbles. Yeah.
Oh, look at me telling everyone to do the Q&A. I'm in the chat. Awesome. Thank you. Thank you. Oh, you got a mixed crowd here.
Gainesville, Georgia.
Yeah. We got Georgia. We have a lot of yeses and a lot of nos.
So Louisiana, Texas.
Awesome. All right. Thank you, guys. Well, without formal ado, I would love to introduce our special guest, Trisha, with Mutual of Omaha, to talk about their brand new hospital indemnity plan.
Yes.
Thank you so much for being here. Welcome.
Yes, absolutely. Oh, I see a question in here from Michael just before I get started. HIP supplies are available on Forms and Materials. We just put those out a couple of days ago. So if you go out on Forms and Materials on SPA, you'll see all the forms out there. And you can grab those, the flyers, the writer flyers, all the good stuff is out there. So definitely go take a look. But I digress. My name is Trisha. I'm the sales manager here at Mutual of Omaha for our senior health products. So I cover our Medicare supplements, our dental, and now our brand new hospital indemnity that's going to be rolling out here on the 15th of this month. So thank you for joining me this morning and the Eldercare team. We're going to dive right into our hospital protection plan. I'm going to be going over the policy. We've got 9 riders, so I'm going to take a look at all of those. We're also going to go over how to submit the business, how to file claims, marketing pieces, all of that good stuff. So I'm going to jump right into it because there is a ton of information on our hospital protection plan. So with that, a little bit of background stats here. In the US, the average cost for one day stay in the hospital is on the rise. Hospital indemnity plans can help your clients offset expenses and protect them financially, regardless of the healthcare coverage that they may already have. So just taking a look at those stats there, it is so important and so necessary to have a hospital indemnity plan on your customers. And before we share the plan overview, it's important that you know a few keywords before we jump in. So calendar year, it's a 12-month period. January 1st through December 31st is the calendar year I'm referring to. Next is hospital confinement, which is defined as inpatient at a hospital for at least 24 hours because of a covered injury or sickness. The period of confinement or reset period begins when the insured has been hospital confined and ends when there has been no additional hospital confinement for 60 consecutive days. And then lastly, an observation stay, which starts at 6 hours. After 24 hours, it's considered a hospital confinement.
Good to know.
Yes. So let's start with a few quick highlights of the plan. So issue ages are 18 to 85, and then we've got GI window from 64 to 74. For those applications not in a GI window, our automated underwriting provides you with quick decision making. So it's going to be issue or decline right away. For those clients that may qualify, we've got a 7% household discount, and I'll explain more of that later on here in the deck. So coverage is guaranteed renewable. So as long as they're paying their premiums, the coverage is going to continue. And there's no client ID card, no policy fee, no app fee, and there's no waiting period for the coverage to begin. So coverage begins day one, and then we've got a 6-month look back period for pre-existing. So we're going to
looking good.
Yeah. So we're going to dive into the base benefits here. So when we're building out that base benefit for your client, the first choice they need to make is during that period of hospital confinement or observation stay, do they want a daily benefit amount or for a certain number of days, or do they prefer that lump sum benefit amount? And they can select one or the other on that application. So let's look at that daily benefit amount. So with that selection, you can choose up to $1,000 from $100 up to $1,000. And we broke that out into $10 increments, and they can choose. Yeah. They can choose.
$10 on a lot of plans.
Yeah. I mean, we were really thorough when we started building this out. And we knew that we wanted to have smaller increments to make sure that we could really customize it for each customer. So it starts with days 3 through 10, 15 days, 20 days, or 31 days. They can choose. And then you would use our e-app or our quoting tool, in which if you don't have our quoting tool, our quoting app on your phone, definitely get that downloaded. It's Quotes for Sales Professionals. And when you look that up in the Apple Store or the Play Store, you'll see the Mutual of Omaha logo. You can quote all of our products on there, life and health. It's an amazing app to have. I use it all the time. You can use it on all of our products across the board. It's not just health. So
you have to log in?
Nope, there's no login. I'm not a licensed agent and I use it all the time.
Good to know.
Yeah, so it's great. But then, so if they're not doing the daily benefit, then they have the lump sum benefit for the confinement or the observation stay, and the lump sum ranges from $100 up to $3,000 with the $50 increments. And additionally, baked into that base benefit, we've got a few additional benefits here. So the base plan pays 100% of the daily benefit amount selected for the lesser of 5 days or the base hospital option stay for an observation stay. A few additional items to note regarding an observation stay. There's no period of confinement like there is for the daily hospital confinement benefit. An observation stay does not stack with the daily hospital confinement benefit. And if your client selected a lump sum benefit option, if a benefit is paid for an observation stay, that uses the benefit for the year. If they have an inpatient hospital stay later in the year, there's no benefit available. And then so the next built-in benefit is an inpatient mental or nervous disorder benefit, and that pays out $175 a day for 7 calendar days a year. And then another awesome benefit that I particularly find cool, that's a part of the base benefit, is pet boarding. So that pays for $75 a day up to 14 calendar days a year when they are hospital confined and they need temporary boarding for their license to board their pets. So that is not an additional benefit. That's part of the base benefit.
That's wonderful. I like that.
Mm-hmm. And so when they have our hospital indemnity, they will also get these additional value adds at no additional cost. So these are opted in as well with the base benefits. They've got the iMed, which provides discounts on eye exams, glasses, contact lenses, with participating providers. They've got the Amplifon, which provides discounts on hearing tests and other valuable hearing services. They've got that Garmin discount, which is going to provide discounts on smartwatches and fitness trackers. They're also going to get a discount with Allocare, which offers discounts on advanced voice activated in-home emergency alert systems and communication systems. And then lastly, our ScriptSave RX discount program, which provides savings and discounts on prescriptions and medication management tools. So those are automatically provided to the customer as well with these hospital indemnity plans. So lots is packed in just with the plan itself.
Yeah.
All right, so moving on to the riders. We've got these 9 optional riders here that I'm going to dive into. So this is really the guts of the policy that we're going to dig into here. First up is the guaranteed purchase option rider, which allows the client to increase their daily benefit amount by 15% after the first anniversary of the policy. They can elect to increase their daily benefit up to 5 separate times over the life of the policy or until they turn 85, whichever one comes first. The additional base benefit premium is based on the original issue age of the policy, and then we don't require underwriting. So it's a really this is a great rider to have on here. It's really a no-brainer for the agent selling this to their customer. If the rider is canceled, that daily benefit does revert back to the original benefit amount, and then the premiums reduce back to that original amount as well. So really great rider to have on there.
So it's a good way to increase that daily benefit without having to go through underwriting.
Yeah. If they buy it at 65 and at 75, they decide they need to increase their benefit for whatever reason, whatever life event has happened in the decade, then they can increase it at that age 65, no underwriting. I mean, a lot can happen between 65 and 75. So this is just a key rider to have on there. Here's an example. Client elects to add that GPO rider to their hospital indemnity. Coverage is effective August 1. In July of the next year, they were notified that they can exercise that GPO rider. And then on August 1, their new daily benefit amount is $575. They can elect to exercise that rider up to 4 more times until they turn 85. So that is what that looks like there at the original issue age and no underwriting. So the next one that is also a no-brainer in my opinion is the lump sum cancer rider. So we know that with medical advances, more people are recovering from cancer than ever before. So cost of care is overwhelming and can create a financial burden, especially when it comes to cancer. So our rider pays for a lump sum benefit to help offset those expenses and protect not only the customer, but the families impacted as well. The client can elect to pay lump sum benefit amount, and they can pay those amounts up there anywhere from $2,500 up to the $25,000 lump sum amount. So the lump sum cancer rider benefit pays out when the insured has a first ever cancer diagnosis. In addition to the lump sum benefit, the rider does also include a one-time benefit of $600 if the client is ever diagnosed with skin cancer as well. The rider is underwritten, and there is a 30-day waiting period. So the rider does end once both of those benefits are paid out. So it is the lump sum rider payment and then that skin cancer payment. Once those both pay out, then the rider is satisfied and then the coverage ends. And then here's just it's a pretty straightforward rider. So here's an example of it. They pay, first ever diagnosis happens after the 30 days of the coverage beginning. We pay out that $25,000 directly to the customer. And then in the future, they get that $600 and then the coverage ends. So pretty straightforward there. I will go over what the underwriting questions are on this later on in the deck, but there are a couple of underwriting questions in order to qualify for this rider. The next one is the prescription drug rider. So this rider reimburses $15 for generic and $30 for brand name prescriptions. Client can select either a $250 or a $500 max benefit per calendar year. So reimbursement is available until the annual calendar year max benefit amount is reached.
I don't think I've ever seen that on a hospital indemnity plan either.
Yeah, I'm not sure how common this one is, but essentially the customer will submit to us their receipt or their EOB, whatever they have showing what their generic or whatever their drug costs, and then we will pay them until they meet their either $250 or their $500 reimbursement. And this is particularly good if we've got customers on those $0 PDP plans. They're going to be, getting money back on those prescriptions. So this is a great one to have.
Yeah. Do you know if you're going to go over like the cost of the riders and then what that looks like when the rider's fulfilled?
I have some samples. We don't have premiums available to provide. Those I'm being told are going to be available on the 15th. So those are kind of going to be first look, first day.
Yeah.
But I do have a sample page that I'm going to show everybody. So yeah. So how the prescription writer works, the policyholder submits pharmacy receipts, like I said, and then once we have that information that's acceptable proof of purchase, we will disperse the payment till they receive their max amount that they paid for. Skilled nursing facility writer offers an added measure of financial protection if the client needed skilled nursing care, intermediate care, or custodial care in a skilled nursing facility. So after an inpatient hospital stay or observation stay, some clients may need continued care and recovery in a skilled nursing facility, especially for more Medicare aged clients, as we know. A covered hospital stay of at least 2 days is needed to qualify for benefits and care in a skilled nursing facility. Must begin within 30 days of that hospital discharge as well. The benefit period ends with 60 consecutive days if not being confined in a hospital or skilled nursing facility when the daily benefit resets. And this is what that benefit looks like. So the client can select a daily benefit from $100 up to $500 in that $10 increment again. And then they also need to choose if they want days 1 through 20, days 21 through 100, or days 1 through 100. And you would be surprised. I've had a lot of questions about why would there be days 1 through 20? Well, it's not a coordination of benefits with Medicare. They would get this payment in addition to what Medicare covers. So I've had a lot of people bring that up. Like, why would you have days 1 through 20? Well, we would pay that in addition to what Medicare pays. It's not a coordination of benefits. So this is what it would look like. So if they had a daily benefit of $250, if they selected days 1 through 20, there's no elimination period. We're going to pay them for days 1 through 20. If there's days 21 through 100, they would have to wait the 20 days elimination period before we start paying their daily benefit. But then if they have days 1 through 100, there's no elimination period. We're going to pay for that 100 days. The next rider is the home health care rider, which provides a daily benefit to help cover the care and assistance the client needs to recuperate at home. So after an inpatient hospital stay or care in a skilled nursing facility, the clients who return home may need help bathing, dressing, eating, other activities of daily living or ADLs. Home health care means care received in the home provided by a home health care agency. So to receive those benefits, it requires 2 days of a confined hospital stay again, or skilled nursing facility confinement. And the insured must have a cognitive impairment or inability to perform 2 of the 6 activities of daily living. The insured's condition must be certified by a licensed healthcare practitioner as well. And on the next slide, I'll have a list of the ADLs that I'm referring to, that they have to have 2 of the 6. The home health care must begin within 30 days of that hospital or skilled nursing facility discharge as well. So they can select the daily benefit from $50 up to $250. And then the insured collects benefits for up to 30 home health care visits per calendar year. And then those are the ADLs listed there. So ambulance and emergency or urgent care rider, this is another one. So when the unexpected happens, the last thing you want to worry about is the cost of a ride to the hospital for care. And I think if any of us have looked at healthcare claims long enough, we know that these are not cheap claims. With the ambulance and emergency or urgent care rider, your client selects a benefit between $100 and $500. Each benefit, ambulance, emergency room, and urgent care, are payable 4 times per calendar year.
So that's all 3 of those?
I'll break it out. So this one's complicated.
Like normally it's separate.
Yeah, so ambulance is ground.
Okay.
Air ambulance. So ambulance is ground, which may include water ambulance. Air ambulance. So it's not 4 ground and 4 air, it's 4 total. So any ambulance ride together, whether water or air, is 4 total.
Okay. But like
There's
urgent care is what I meant. It's like included in that.
Yes, urgent care is paid out 50% of the chosen benefit amount. There's an example on the next page I'll show you.
I like how you're doing things different.
This one confuses me. And then ambulance and ER benefits can be payable on the same day. So here's a good example. So your client chooses $100 rider benefit effective January 1. This person has some tough luck because on January 3rd, they submit a claim for ground ambulance. The rider pays $100 and then they have 3 ambulance rides left for the year. On February 5th, they submit a claim for air ambulance. The rider pays $1,000 and then they have 2 ambulance rides left for the year. And then in March, they submit a claim for urgent care. The rider pays $50 and then they have 3 urgent care visits left for the year. And then in April, they submit a claim for the emergency room. The rider pays $100 and then they have 3 emergency room visits left for the year. So all ambulance is 4 total, emergency room and urgent care. So each of them is 4. Does that make sense? Air, water, ground.
Yes.
4.
I might have to listen to this again, but it sounds like it offers like a lot. Like it doesn't pay out just once. Like they can go to the urgent care multiple times.
They go to urgent care 4 times. They can go to the ER 4 times. They can ride in an ambulance 4 times.
Yeah, that's awesome.
Yes.
I understand now.
Okay. The next rider is outpatient surgery. So outpatient surgery rider provides an additional benefit to help cover the cost of surgery received in an ambulatory surgical center or outpatient hospital facility. So they can choose the benefit amounts listed up there up to $1,000. There is no waiting period. The coverage starts as soon as the rider is issued. Benefits are paid for a maximum of 2 outpatient surgeries per calendar year. There's no benefit reset period. Only be 1 payment per day. So if they have 2 surgeries in a day, we would only pay 1 payment. So they would need to have a surgery one day and a surgery the next day for them to be 2 different payments. Documentation from the surgical center or the outpatient facility is required on this rider. So we would need verification on this particular rider for payment. Outpatient therapy rider. So when they add the therapy rider, they'll get benefits to help pay for occupational, physical, or speech therapy. The benefit is paid for therapies in an outpatient setting, regardless of the health issue that triggered the hospital stay. They can choose the daily benefit of up to $250, and they can also select if they would prefer 15 or 30 calendar days per year. And then there's also a chiropractic benefit of 5 calendar days per year automatically included in this rider. The benefits paid, once per day, even if multiple therapy sessions occur. And then the benefit is paid for therapy sessions in an outpatient setting, not a home setting. And so here's an example. Your client elected 15 days per calendar year at $200 per day for the outpatient therapy rider. Due to a leg injury, their doctor recommends to see a physical therapist once a week for 4 months. In August, they have their first 4 sessions. They continue with sessions 5 through 12 through October. Sessions pay $200 benefit. In November, they have 3 more sessions that pay $200 benefit. The last session, 16, does not pay a benefit, and they've met their 15 calendar day per year max. So pretty straightforward.
I don't know that I've ever, like I've done a lot of like fill the gaps, from MA plans. I don't know that I've ever really paid attention to like outpatient therapy copays and stuff.
Yeah.
Curious to see how that looks.
Yeah. And this one's up to $200 per.
Yeah, that seems like a
so,
lot.
Yeah. And then we've got major diagnostic testing, which covers the cost for major diagnostic testing. So they can choose from $100 up to $500. There's no waiting period on this one, so coverage is going to start on day 1. The benefits are paid for a maximum of 2 diagnostic tests per calendar year. There's no benefit reset period. And on this one, they can do 2 tests in the same day, and we will pay for both of those tests on that same day. And then this is another one where we would need documentation from the hospital or the medical provider to pay that benefit. So we would need to see proof of that testing.
Just proof of the testing, not proof that it was like needed or anything.
Nope, just proof that the test happened. Yep.
So I could get the plan and next day go get a major diagnostic test.
You could get it same day. You could get the plan effective August 1 and go get a CT scan August 1 and just show us that a CT scan happened on an EOB and we'll pay you the benefit.
That's cool.
Yeah. So these are the covered diagnostic tests. And that's 2 tests a year.
I don't know what all of those are, but I'm going to be interested to know what they are.
I recognize the majority of them, but yeah. So those are the 9 riders. Hopefully you memorized all of that, but we will move on to the underwriting and app processing and take a look at that. So outside of the GI, which like I said was 64 to 74, there are 2 health questions that will be answered on the underwritten applications. And this is just the general 2 questions on the underwritten apps. Within the last 5 years, have you been advised by a medical professional to have any medical test, treatment, therapy, or surgery that has not yet been performed? And then the second one is, do you have any pending test results? Those are the 2 questions. It's a pass-fail.
That's it?
That's it. And then on that cancer rider, like I said, there's additional questions. So these are the 3 questions. In the past 5 years, have you been tested to determine if cancer is present? If yes, are the results still pending, or have the results indicated that you require further treatment or evaluation? Second question, have you been diagnosed with, treated for, or currently seeking treatment for cancer? Third question, have you been recommended to receive a colonoscopy, mammogram, or lung CT scan or other test as part of a routine screening for cancer, but not completed this screening? So those are the three. I will tell you, if the customer has ever had cancer, we will not issue the rider. So there is no waiting period. There is no 5-year, 6-year period. It's 0 cancer. So keep that in mind. And then the household discount that I mentioned. So we offer a 7% household discount at the time of application if a household member either has an existing hospital indemnity policy or is applying for coverage with Mutual of Omaha. So it's similar to our 7% household discount that we offer with Mutual of Omaha's Medicare supplements. A household member is someone who has continuously resided with the applicant for the last 12 months, or is someone who they reside with and is married to or a civil union partnership. So it is anyone 18 or older, since the coverage is for anyone 18 to 85. So it has to be both members in the household have a hospital indemnity with us in order for both members to receive that 7%. Premium structure. So premiums are unisex, so they do not vary by gender. They are based on applicant issue age, meaning premiums stay the same as they get older. Rates do not vary by tobacco or non-tobacco. They vary by state. As we went over, a 7% household discount is available for qualified individuals, so that's also going to impact premium. There's no policy fee, no app fee. Initial premiums are due with the application and can be paid by automatic bank draft or credit card. Ongoing renewals can be made by bank draft or direct bill, either quarterly, semi-annual, or annual. If you are familiar with our dental plans or our med sup plans, it's the exact same premium rules as those products as well. So it's the same rules across the board. Quoting, like I mentioned earlier, you will quote and it will be through the e-app. So when you open the e-app, first thing you will do is run a quote, and then you'll decide if you want to apply for the coverage. That's how all the e-apps begin, is you run the quote. And then I mentioned that mobile app, Quote for Sales Professionals, key app to have. Definitely download that just so that you can quote any of our products. And then that's going to help you build out that HIP policy when you're talking with a client, just to kind of give them what those premiums are going to look like.
Yeah, I'm asking Siri to remind me to run some quotes on the 15th.
I love it. I use it all the time, especially for dental, because you just pop in a zip code and it pulls it up right away. So here are the sample rates. I'll give you a moment to look at these. Rates vary by age, discount, benefit options, state. This sample is just showing monthly premiums. So this kind of gives you an idea of what we're looking at here.
Yeah, even age 75, the base isn't outrageous.
Yeah, it seems low. Very reasonable.
So, so how to submit an application. So it's just like I said, like our other senior health products, it's in the e-app portal in Sales Professional Access. On the home page, when you log in, you'll see electronic applications. You'll click on there, and then you will see the hospital indemnity e-app storefront. Well, you'll see the storefront, and then you'll click on hospital indemnity and go from there. Super straightforward. We don't have paper applications. It's all electronic, so you'll have to go in there to do that. And so how to submit a claim. So step one, you will obtain the UB04 hospital billing form and or the facility services form from the billing department. These forms will include revenue codes, procedure codes, diagnostic codes, admission and discharge summaries, which show the dates of service and reason for inpatient stay. It can be submitted or substituted for the UB04. And then the second piece is we need their policy number, name, date of birth, address, phone number, email address, all those credentials. And then you just submit it to us. I would suggest submitting via email, but you can mail it to us if you'd like, or you can call in the information or fax it if you have a fax machine. But I would definitely say call in the information or send it via email would be the quickest way and quickest turnaround for them to get their benefits.
Gotcha. Yeah, we want to know how quick we can get them paid.
Well, if you're familiar at all with our MedSup claims and our dental claims, we do have a very fast turnaround time. We are not holding up claims for 30 days. We 90% of our claims are auto paid, auto adjudicated, and paid out immediately. We've got a whole team on standby ready to pay these HIP claims. So that's not going to be an issue. We are ready to get these payments out the door. So it's going to be a pretty quick process, pretty seamless if we can get the information in quickly. So
yeah, like I kind of got lost on the how to submit a claim. I mean, is that what the agent can do, or is that all on the client? Or
the agent can do it. Yep. There is information out on forms and materials on what is needed. We do also have a claim form. I was just provided the claim form the other day. I can send that over to you as
yeah,
well.
just we'll have it if an agent needs it.
Yeah, that'll be out on forms and materials as well. So it's pretty straightforward. They can submit that to us. But again, like I said, they can submit that information over the phone too. And sales and the team who takes that information will be able to walk them through what's needed to initiate that claim. So sales and marketing. So we have some materials out on forms and materials like I've been like I was saying. So we've got this hospital protection plan flyer that has all of the high level information as far as base plan, just really all of the important bits and pieces that we went over listed on here on the front, and then on the back is rider information. So that's out there on forms and materials. And then we've got a flyer on each and every one of the riders that we went over. Those just released out on there as well. I think I sent those over to you yesterday, Adrian. Do you have those?
I believe so. Yes.
Okay, perfect. Yeah, so those are a great reference guide as well. That gives you, and those examples are listed on there as well, so that you have those for a good reference too.
Yes, if you attended this morning, we will have that in the email to you. Okay, good. Yeah. And then we do also, we're going to offer consumer materials. So we have a point of sale brochure. There's a prospecting letter out there. There's going to be the claim process information out there as well. So definitely go check out forms and materials. If you have questions on navigating that, you can reach out to me and I will help you go find it out there. Or I can send it over the materials to you if I can find it too. And then in our social media hub, if you're not familiar with it, we have a social media hub out on Sales Professional Access as well, where we have pre-approved social media posts that you can copy and paste and post out on social media. So if you're big out on social media, LinkedIn, Facebook, any sort of whatever social media outlet that you use, these are pre-approved and they are relevant and we keep them updated. You can just copy and paste and put them out there if you need to blast the product that you want that you're wanting your demographic to see. So we have those out there as well for you to use.
So if an agent is already appointed through us for Mutual of Omaha, are they already going to be ready to write this product, or do they need to? Okay, perfect.
Yep, we're going to automatically in 2 days, all agents are going to be, if they already have a Medicare supplement contract with Mutual of Omaha and they're active, then we're going to automatically add that hospital indemnity. So Eldercare doesn't have to worry about it. The agent doesn't have to worry about it. We're going to automatically seamlessly add it in there. They're going to be good to go day one. And then as long Yep, you will. Okay. And then as long as they have a health license in the state that they're going to be selling in, they're golden.
Okay. Great question.
That is a great question. So to wrap up here, issue age 18 to 85, GI 64 to 74, automated underwriting. So you're going to know right away, pass or fail. That household discount of 7%, no policy fee, no app fee. And this is very important information. So this is our sales support team. Our sales support team maintains a 30-second average speed to answer at all times. If at any point it gets above 30 seconds, we have additional teams that hop on the line to keep it at 30 seconds. So that's a promise. And our sales support email inbox has a 1-hour turnaround time. This is going to be your first line of defense if you have any questions. We do not want to keep you on the phone. We want you out in the field. So definitely keep this information. If you do not want to contact them, you can always contact me as well. I have my information and my account executive's information at the end of this slide that you can take a picture of or write down if you want. But this is our sales support information. And then these are the state.
And you can meet her in person at our conference.
And I will be there. Yes. So come say hi to me. And so these are the states that we are initially rolling out in. But in addition to this, we have 1, 2, 3, 4, 5, 6, 7. We have 8 additional states that we are working to also roll out prior to AEP as well. But these are the first 17 states that we are going live with. And these are the first 17 states that we are going live with. And then we'll have additional states that we continue to roll out between August 15th and October 15th. So this is where we're starting.
Looks like it's in the majority of the states our attendees are in.
Yep.
I like it. And so here's my information. Jenna Kruger is my account executive. She is the best account executive, I do have to tell you. So keep her information as well. But again, thank you for the opportunity to talk to you guys this morning. I do see a question in here from Adam about the GPO. He says, is that 15% per increase or 15% accumulated? And it's 15% accumulated.
Okay. Great question, Adam. Thank you for asking that. And we do have quite a few other questions. I know we're a little over for time, so I don't want to spend too much time answering these questions, but I'm going to go through and try and ask some of them. Michael had asked about if they're not admitted after 6 hours because he said they kept his mom in observation for 4 days.
Oh, isn't that would be considered that wouldn't be considered observation at that point, because that would be over 6 hours. Yep, 6 hours is observation, and then after 6 hours it's considered a hospital stay, hospital confinement.
Yeah. And then yes, Michael, the option is either a day benefit or lump sum. You can't do both for the hospital based plan.
Correct.
And then I think we have quite a few questions. I've been going through these about, I think, the value adds you were talking about in the riders and how they work with like that main health coverage plan. And I mean, the best way to describe, you know, these types of hospital plans is they're indemnity plans. They don't have anything to do with their, you know, immediate healthcare needs with their health plan. This is just something that's in addition to. Correct. So if you do get, you know, if they do have a Medicare Advantage plan with prescription drug coverage, and you do that prescription drug rider, that's just something they can file those receipts with and then just get cash back as well, in addition to that plan's copays.
It's not prescription drug coverage. You can't sell it as Part D coverage. It's just a reimbursement. Yes.
Yes, and that's the same. I think we had questions about like those value adds, like the hearing and everything like that. Those are just discount opportunities. It's not like hearing coverage or vision coverage. It's a great opportunity for you to see. Sometimes it is cheaper if you use a discount card versus the coverage, and then you can decide how you can use that.
That's how Script Save RX works. That one actually is on our dental as well. I have Mutual of Omaha's dental coverage and I use that as well.
Yeah.
Adrian, if you want, for the sake of time, you can send me these questions via email and I can answer them all. And if you want to broadcast them back out to your team or whatever works best, or if you all have my information, if any of you want to reach out to me directly, I can certainly chat with anybody that's on the call too.
Well, we greatly appreciate that. Thank you so much for taking the time to talk about this new product. We're excited.
We are super excited to have Mutual of Omaha joining the hospital indemnity world. So
yeah, well, internally, we all have a competition of who's going to submit the first application. I would love to see it under Eldercare.
Yes, absolutely. Me too.
Who's going to do it? Who's going to do
Who's
it?
going to do it? That's awesome.
That.
You got to let us know if it's one of us.
Oh, I will for sure. I will let you know.
Well,
Awesome.
Thank you, Trish.
Thank you. Everybody have a good day.
Yeah. Thank you, everyone. Bye.